Aspirants, very good evening. As we know, today we have a session for therapeutic plasma exchange, and we have a speaker with us, our party. And we know that he's a very senior chief intensivist at HN Reliance Foundation Hospital, Mumbai. He's our speaker today. And we have organizers with us, Dr. Akhilesh Tandekar, Dr. Asif Iqbal as well. So hope we can just start the session. And aspirants, a very warm request, then please just keep your mics off. And if we have any questions, we can do it after the sessions. Please. So over to you.
Yeah. So today the topic is therapeutic plasma exchange. So basically, I'll just go through the topic like in a very short and practical aspect. We'll discuss. See, there are a lot of things in the theory, but we'll discuss about the practical aspect. These slides are being taken because from one of my esteemed colleagues, Dr. Bishaw. So I really thanks to him. But we'll just discuss the concept of therapeutic plasma exchange and how does it helps in the clinical practice. So as all of us know that this is one of the very burning area, and most of the times in the ICU when the patient is critical, particularly suffering from autoimmune, hematologic, many of the neurological conditions. So those cases, this is one of the important aspect to treat the patient. So this is called the therapeutic. Why therapeutic? Because here we employ different techniques of good transfusing the good plasma, also different cells, also different fluids in exchange of the plasma which we removed. So this is called therapeutic plasma exchange. Why it is exchange? Because the plasma own plasma is being exchanged. The own plasma is being exchanged with the fluid, which can be either blood, which can be either albumin, which can be either normal saline, which can be either free frozen plasma from the donor itself or from the other population. So that is why this is called the therapeutic plasma exchange. So if you see the therapeutic apheresis components basically. So what we practice in our clinical practice, one is called the therapeutic plasma exchange, which you do normally in the ICU. Second thing is something called as cytopheresis. Cytopheresis means only removal of the cells. So therapeutic plasma exchange remove both the plasma as well as the cells, to certain extent the cells and some proteins, whereas the cytopheresis is particularly to do the remove cells which are troublesome to the patient body. So particularly the cells like RBCs, WBCs or platelet. So there are certain conditions where the RBC counts are very high, particularly like, or there are abnormal RBCs in particularly cases like sickle cell disease where you want to remove it, and this is done by the means of erythrocytopheresis. There are certain conditions where the leukocytes counts are very, very high and you need to remove them for the therapeutic benefit. These are called the leukocytopheresis. Or there are certain conditions where you remove the abnormal platelets. Those cases are called thrombocytopheresis. We are not going to go to the detail of all those things, but what we are more interested is like the therapeutic plasma exchange, which again of like done by a different technique. That is why the name varies. One is called the centrifugal technique, so which is commonly done by the pathologist or the hematologist in the hospital by specialized instrument, which is called the centrifugal pump or centrifugal system. Or you can do the therapeutic plasma exchange by the normal conventional dialysis machine, either by the normal dialysis machine or by the CRRT machine. So when you do through the CRRT machine, this is called the membrane filtration technique. Or through the dialysis machine, you can employ certain specialized filter which are only made to remove the plasma. This is called the membrane plasmapheresis. Whereas the centrifugal pump, where the technique is little different, it usually employed by the hematologist, pathologist, or the specialized in those field, and they basically prefer to do the centrifugal technique of plasmapheresis. So as the name suggests, centrifugal is basically nothing but there is a pump which rotates, and by the centrifugal force, it basically separates the different blood component. Whereas the membrane, by a means of the filtration technique, it basically segregate the different blood component, including the plasma, and segregate the plasma into different smaller molecules. So what is the difference between the normal dialysis versus the filter which is employed in this therapeutic plasma exchange. So as you know, all this dialysis or filtration process, it depends on the pore size and their molecular weight. So there are two things. One is called the molecular weight and second is called the pore size. So as the molecular weight increases, the normal dialysis filter are not able to filtrate everything possible. That is why you require certain specialized filtration, particularly with the help of CRRT, which mostly work on the principle of convection. So that is why they can able to filter the middle molecules or the higher molecules to certain extent, which is not being done by the conventional dialysis machine. Okay, similarly, the specialized filters which are employed for this plasmapheresis technique, their pore size obviously is more, and they remove molecules which are, I think, more than 50 kilodalton or sometimes 75 kilodaltons. And these are the larger molecules, particularly the immunoglobulins, which actually they remove, or antibody antigen complex, or something cytokine complex, or something called as your other macromolecules, toxins, which are having a higher molecular weight, or their half-life in the blood is like quite extensive, so that they are not normally able to filter through the normal mechanism of the body. So, can the moderator like mm, make the background little mute so that it will be easier for me to discuss? There are a lot of disturbances are coming in between. And request everybody to keep their mic on the mute mode. So this is called the centrifugation technique, as I have already just discussed. So the principle is by centrifugation pump, the centrifugal pump which rotates, the blood passes through the centrifugal pump and it separates the different blood component, the blood cells, as well as the plasma.
मुझे एक
Okay.
सॉफ्टवेयर मांग रहा था इंस्टॉल करने के लिए रोज़ेटा करके किसी जो 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 यूज करता है ना एक मिनट कुछ प्लगइन्स डाल के रखते
So depending on their specific gravity and density. So this is a very important concept because this where the specific gravity and density plays a role rather than the molecular size. Whereas in membrane filtration, particularly the filtration happens depending on the molecular size. That is the reason these machines are better in separating the blood component also, in addition to your something called as the plasmapheresis technique. So if you want to separate the individual cells, the the centrifugal plasmapheresis technique is somehow better, okay, compared to the your membrane filtration technique. And if you want to also sometimes remove the volume of the plasma in a much more larger amount, then the centrifugal your systems sometimes they are more efficient. But there are studies which shows that there is absolutely no difference between the treatment modality of membrane plasma filtration versus the centrifugal plasma filtration. This is a simple membrane plasma filtration. See, it works on the principle of filtration, hemofiltration, hemodiafiltration. So basically, the plasma is removed from the patient blood by filtration across the plasma filter membrane. Here also it can separate the blood component, but not to that efficient like the centrifugal pump. But this basically based on the molecular size, and the technologies which is the employee is called the convection. So just like the CRRT machine, here the convection principles it comes into play, unlike the your centrifugal pump technology, where basically the specific gravity and the density are the major determinant for the separation. So here the another thing is that, as I already told you, like there are very limited cellular components are being removed. So in comparison to the centrifugal pump, that is why if you see the chances of thrombocytopenia, the chances of leukopenia, and everything is more profound after the centrifugal plasma filtration technique compared to the membrane plasma filtration technique. Okay. And they are also like, if you want to remove the larger volume in a very limited time interval, these are not good because they remove as per their own filter pressure and the blood flow rate. So that is the reason. So you have to have a time duration which is specified in for that particular CRRT machine compared to the centrifugal technique, which actually they can remove almost I can say 80 to 90% within 3 to 4 hours, compared to the membrane filtration, which almost work for sometimes you can say sometimes for the 24 hours also. It depends on the your filtration your filter type. So these are the comparing the different modes of the apheresis technique. So one is the centrifugal technique versus the membrane technique. So the centrifugal technique works on the centrifugal force. The membrane techniques work on the capillary membrane filtration pressure. And here almost the blood flow rate you have to very important, because in case of membrane filtration you will slightly require a higher blood flow rate, okay, to filter out the things compared to your centrifugal pump, where the blood flow rate sometimes you can also keep low. And here the most important thing is that for centrifugal technique you don't have to require a central line, you can do it through the peripheral line. You have to just connect the pump to the peripheral line, the pump will rotate and it will suck the blood and the filtration can happen, compared to your CRRT machine or normal your dialysis machine where you require a dialysis catheter. This is the one of the very important difference, because you have to put a dialysis catheter to carry out this procedure like membrane plasmapheresis. Okay, so there are a lot of complications sometimes happens because of the your dialysis catheter also. If the patient has a prior dialysis catheter, you have to ideally check whether that dialysis catheter is patent or not. Okay, very important, because sometimes the flow is inadequate. In that case, your CRRT or your dye filtration may not work properly, and you may have to stop the procedure in between. And if you see the plasma extraction percentage, centrifugal, I already told you, for removal of the plasma, the volume of the plasma in a certain time, it is better, almost 80% compared to the membrane where it is 30%. Okay. And the plasma removal, it can variable. Okay. The anticoagulation here employed is typically the citrate. This is one of the very important point, because the centrifugal pump, they employ citrate. Citrate is nothing but it is a regional anticoagulation, where the anticoagulation only happens in the machine, but the anticoagulation doesn't happen in the patient body. But there are a lot of side effect to it. So if there is an extra citrate load, then that can chelate the calcium which is present in the patient blood. And after the blood is being returned to the patient can develop severe hypocalcemia. So most of the times within first 15 minutes, if the patient complains of numbness, tingling, perioral numbness, particularly some kind of like your hypocalcemia signs like tetany, carpopedal spasm, then it is more likely to be due to hypocalcemia. So hypocalcemia is one of the very known complication of centrifugal plasmapheresis technique. Whereas as you know that the membrane plasmapheresis it employs heparin or sometimes citrate. If it is a, you can say it is a CRRT based plasmapheresis, but most of the times they employ the heparin, and heparin is agent which also can cause anticoagulation in the patient body also. So that is the reason there is a chances of bleeding and there is a chances of coagulation dysfunction after the plasmapheresis get over. So you have to always check for the patients different your coagulation parameter. And already I told you the separation technique, the centrifugal technique employ this concept of specific gravity or density. And as per the density, the different cellular component as well as the liquid component gets separated. The membrane technique, it employs the molecular size, and particularly these molecules are larger molecular size with a very prolonged half-life, so that they cannot be not naturally, they can be eliminated from the body, like certain toxins where the half-life is almost 48 to 72 hours. Certain antigen antibody complex, cytokines, complement systems, those things they usually don't get cleared, okay, from the body, and that is the reason you employ this technique. The blood volume approximately in centrifugal pump, it approximately 180 to 200 ml, whereas the membrane technique 125 to 150 ml. That is the blood volume which remain inside the filter. And as you know that different form of sterilization like ethylene oxide, the fluid replacement, you can use any fluid in both the systems, albumin, fresh frozen plasma, normal saline, or sometimes also blood also you can use. Okay.